Ladies and gentlemen, thank you for joining us today. Our program will begin shortly. Please welcome today's Master of Ceremonies, UIC's Vice Chancellor for Health Affairs, Dr. Robert Barish.
Thank you. Wasn't that a fantastic video? I mean, amazing. Yes. So greetings and welcome to the ribbon cutting ceremony for the UI Health Specialty Care Building. My name is Dr. Bob Barish, and I'm the UIC's Vice Chancellor for Health Affairs, and it's my pleasure to welcome you to our Health Sciences campus as we launch the newest clinical facility located in the heart of the Illinois Medical District. Many of you know that this project has been the vision for our hospital and clinics for over 20 years. As we look to welcome our first patients into this incredible new building, each of you who are here with us today, alongside our entire UI Health community, should be congratulated for your contributions to making this a reality. We are honored to host many of our university and health system leaders who will be speaking later in the program. Welcome to UI System Trustee Cepeda, President Colleen, and UIC Interim Chancellor Reyes. We'd also like to recognize our former Chancellor, Dr. Michael Amaritas, who came here from South Carolina. Now, I would especially like to recognize our generous donors, Bruno and Sally Pasquinelli, for their transformative gift naming the Outpatient Surgery Center. Additionally, we'd like to recognize the Panton family, Peter, Robert, and others here today for their support, which named the waiting area of the ophthalmology clinic on the 5th floor. Thank you, Jim. I'm sure many others will echo our immense gratitude for your gifts. We're delighted to be joined by several legislative partners and civic officials who represent our patients and neighborhoods. We deeply value your commitment and collaboration to benefit the health and lives of our communities. Now, I see we have Representative LaShawn Ford here, Representative Teresa Ma. We may have other representatives who I came in, and please stand up if I haven't recognized you. And I know we will have our speakers later today, which we're looking forward to hearing you, Lakeisha and also Representative Burnett. Please stand up. Throughout my career, I referred to healthcare as a team sport, and the launch of a new clinical building is no different. In fact, it takes a team of teams to achieve this collective goal. On behalf of the entire academic health enterprise, I would like to extend my sincere gratitude to each of those, to those with us in person and those who are watching online. Today, we pause to recognize our incredible teamwork and dedication to the vision of the UI Health Specialty Care Building. Through the work each of you has put into this project, UI Health is fulfilling its mission of delivering outstanding care, making innovative medical discoveries, and training tomorrow's healthcare leaders. So sincerely, we thank you. It's now my pleasure to welcome to the podium University of Illinois Board of Trustees, Raymond Cepeda. Raymond.
Thank you, Dr. Barish. I really appreciate this opportunity to speak to you all and welcome you all on behalf of the Board of Trustees of the University of Illinois System. I want to recognize the importance of our donors who contributed to this really state-of-the-art building. I haven't been in it yet, but I hear it's beautiful, and I'll get in there a little bit. But really want to recognize the Pasquinelli family for their generosity, as well as the Panton family. You know, without your help, these things don't really get done as quickly or as well. So thank you both. I also appreciate the support of all our elected officials here today. Also very necessary in completing projects like this. Congratulations to everyone whose efforts made today really wonderful. And I know we really can't single out any one person in particular, but since it might be one of my few opportunities, I do want to thank you, Michael, for being the driving force behind this and for coming and joining us on this special day that you had a great hand in. So thank you very much. As a member of the board, it's particularly gratifying to see how the decisions that we make in our committee meetings and our board meetings really impact our communities in such a positive way. While we're part of the initial process of the project, such as the one we're putting in action today, it's inspiring to see the outcome. Today we have added yet another level of healthcare access for people who need the services of the university's healthcare operations. I'm delighted to know that as part of the flagship university system in the state of Illinois, we are making a difference in people's lives right here in my community where I grew up in Pilsen, right down the road here. So really just want to thank everyone for their contributions and for coming here for the opening or the ribbon cutting of this wonderful building. So with that, It's my pleasure to welcome the President of the University of Illinois System, Tim Killeen.
Thank you, Trustee Cepeda. What an exciting day. What an amazing accomplishment. How quickly did this thing rise up from nowhere to somewhere? Bruno, Sally, Peter, families, way to get things done. Move it forward. And Michael Amaridis, I don't know what to say about Michael Amaridis, but he's my friend, my partner, but we can tease him because but congratulations on this magnificent accomplishment too, and everybody involved. I'm genuinely pleased and delighted to be here and proud to celebrate the fruition of this much needed resource that will greatly improve access to exceptional health care for so many of the city's surrounding communities. It's that important. The Specialty Care Building is now another amazing UI Health contribution on the Chicago landscape of our ongoing commitment to improve the health and well-being of each and every patient in the region, and a tangible reflection of the University of Illinois System's mission, the land-grant original mission, to transform lives and families one at a time and to serve society profoundly. It's also a textbook case study of just how to implement it and how to implement a public-private partnership the right way. So my hat is off to all who, I have multiple hats, who work together so successfully to make today a reality. And I thank you for the brilliant collaboration that of course has occurred at the time of a pandemic as well. So what a tour de force. One of the greatest joys of being a system president is witnessing the stellar achievements realized by our various enterprises, and we have them all across the state. The breadth of this accomplishment is quite extraordinary. So as we celebrate the birth of this new building and all the good it will do for the many, many thousands of Chicagoans who will pass through its door and receive hope and recovery, which is the phrase that I heard today from our stellar doctors, I offer my most heartfelt congratulations. And now it's my pleasure to introduce University of Illinois Chicago Interim Chancellor Javier Reyes.
Good morning, everyone. It's a pleasure to be here with you today. Thank you, President Killeen, Trustees Ramon Cepeda. Thank you to our elected officials who are here with us today. It's truly an incredible day. And I just want to take a moment real quick to say that we spend a lot of time planning things. We spend a lot of time thinking about how we're going to do groundbreakings. But then some people get to do. And Michael, you did that with the rest of the leadership. You got things done. And this is something that we want to thank you, because this is part of your legacy here at UIC. So thank you. But nothing... What I heard today from both the Panton family as well as the Pasquinelli family, it's not the culmination of something. It's not the end of something. It is actually the beginning of a new era for UI Health, of a new era in ophthalmology, in outpatient care surgery, specialty care surgery. And they spoke, both of them, about how they want to see the next steps, how they want to see us build on this. This is, the Panton family referred to it as a phase 4, and they say that the phase 5 is already on the radar. When the Pasquinelli said, you're not getting rid of us dead, we have more to do, and we want to do it with UI Health. This speaks of what we can do together when we find the needs of our community, when we find the leadership that we want to have, and they want to make change. Most importantly, both of them said that this is to serve patients that otherwise may not get the care that they deserve. So thank you to both families for making this happen today. You will hear more about the building soon, but as you know, it's not only about the care that we will provide, but it's also what exemplifying for UIC, for UI Health, being a building that will achieve LEED Gold certification for environmental sustainability. It reflects our focus again, on climate mitigation, throughout the recent surge of building and renovations that we have across UIC. So it's setting a standard of what we're up to doing. The new state-of-the-art facility is expected to begin serving patients next month, and it's projected to host 200,000 patients in visits every year, and more than 8,200 surgeries. This building is further evidence of UIC's mission to service Chicago communities that dates back well over a century to the founding of our two oldest colleges, medicine and pharmacy. This new facility exemplifies this commitment that is in our DNA. We are a social justice-based university that will provide access to all the patients, that will provide access to education. And we couldn't do this without the friends that helped us here get today. So thank you very much. Thank you for your support. And let's go to the next part of the program. I forget, I have to introduce, sorry, my fault, Bob. Now it's my honor to welcome the 27th Ward Alderman, Walter Burnett, Jr.
Thank you very much. First of all, I'd like to thank you for picking up the ball and running with it. I also would like to commend the former chancellor who's done a fantastic job. And I would be remiss if I did not acknowledge the Pasquinelli family, whom I had the opportunity to meet with when they donated to the robotic facility down the street. You guys are just donating to so much, and I think at that time I told you when I grow up I want to be like you, right? I want to be able to just give my money and help people, and appreciate the fact that you mentioned to me how you grew up in the area, and you want to just give back and help people where you come from. So thank you very much for not forgetting where you come from. We appreciate your family very much. I'd like to commend Dr. Barris, the board members, the president, everyone involved, of course, to my colleagues in government, in the state. Thank you all very much for all you do to help with health care for people in the state of Illinois. So proud of this building. I was here for the groundbreaking, and also I just want to thank them at the specialty building, being able to service so many people from around the state and sometimes from out of the country to be able to get services here. But I'd like to thank them for outpatient surgery, ear and eye transplant, urology, all of those great things and extra things that we constantly need in our society to help people with their health. And you guys, I'm telling you, you guys are on fire, man. You all are competing with all of the private institutions, and it seems like you're just growing faster than all of them. And it's incredible and it's commendable to have a public institution to be competitive with so many other private institutions in this city and in this state. So give yourselves a round of applause. But being an alderman, right? I'm an alderman over here. So, aldermen, we have to take care of our wards. So we have to be somewhat very selfish in respect to our wards. And in this case, this organization has been very considerate in hiring minority contractors. Matter of fact, 35% of the construction was done by minorities. 20% of the personnel services was done by minorities. So that's like 55%? That's commendable. We'd like to thank you very much. And a lot of folks from this ward and from the west side were able to work on this facility. So we really appreciate that. You all need to be commended. I was in meetings with you all every month to work on that and to make sure that happens. So I'd like to commend all of your staff and everyone who has worked on this. I mean, it's fantastic to have people from the neighborhood to work on a facility that's going to service them, right? A facility that's going to service people from all levels, from people who don't have insurance to people who have the best insurance in the world. And most, from what I understand, the majority of the people that you're serving are people on Medicare and people who have other type of public insurances. So that's commendable. And I just want to say thank God for you all. And I'm happy to be alderman at this time to be able to cut a ribbon and be able to work with you on this facility. Congratulations to everyone involved. Thank you.
Thank you, Alderman Burnett. We appreciate your continued support and partnership and your enthusiasm for UI Health. So thank you. It's now my pleasure to welcome to the podium CEO of the Hospital and Clinics, Mike Zen.
Thank you, Dr. Barish. And welcome and thanks to all here today. Please know there is inadequate time and words to convey properly the story of this wonderful facility and the magnitude of gratitude to so many who have made this happen. With that disclaimer, indulge me as I mention a few things that I feel most important today. Many have asked how this building and business expansion has been funded. There are three aspects to the funding. The first starts with the gracious gift from Bruno and Sally Pasquinelli. They have been longtime supporters, as has already been mentioned, of the hospital and the College of Medicine. Their gift provided the substantial support to make the surgical aspects of this building happen. More importantly, it was their commitment to this endeavor that set the stage for us to have the confidence to move the project forward. This, combined with the great support from the Panton family, are a key part of how this building was and this great facility was funded. The second aspect of funding comes from the reserves of the hospital that it has set aside through its financial diligence. As you have a chance to go through the building today, many of the technologies within have been funded by these carefully planned reserves. That's a part of what will help us make sure we can do this today, do it tomorrow, do it for the next 30 years. Now to the third aspect of funding. In concert with the university and campus resources, the hospital leveraged a public-private partnership, or P3, it has already been mentioned, for 80% of this project. This allows for the hospital with its partners, the College of Medicine and the College of Pharmacy, to pay for the building through a 30-year lease, or 80% of the building through a 30-year lease. This financing also brings with it construction management that has accelerated over traditional methodologies, the ability to deliver the building, along with competitive financing rates. The collaborative design approach of the P3, involving the developer, the architect, the contractor, the user, yields a more satisfactory product for the stakeholders. Those stakeholders being the College of Medicine, the College of Pharmacy, the hospital, all of you, all of our constituents. On August 13, 2020, roughly 30 yards to our west, we celebrated the groundbreaking for the construction of this building. 25 months later, we are here at the ribbon cutting. My congratulations to everybody for accomplishing that great feat. This P3 project is a partnership between the University of Illinois, Chicago, and the Provident Resources Group. Thank you to all the members. Well done. I'm going to mention them quickly. Provident, Misero Financial, Ankara, ZGF, Shive Hattery, Pepper Brown Moman, Target Group, Community Empowered Through Construction, Walsh, Art Expressions, Interiors for Business, JLL. I would list names, but I will run out of time. There's a laundry list of names that we could go through. Additionally, UI Health is forecast to exceed several Business Enterprise Program, or BAP, goals. Alderman Burnett already mentioned this. These goals have been fundamental to how we have gone through this. And they're not just goals. It's our responsibility to these communities and to our community to utilize the capabilities within the community. We committed for the construction of the SCB 20, we'll wait for the pink line. That is the pink line that goes by us. 20.3% of professional services are BEP vendors, over our goal, and 35.4% of the construction vendors are BEP, again, over our 30% goal. Within this, our focus has been local. Local enterprises, local workers. It is an important aspect to our supporting the economic health of our communities as a mechanism in supporting the overall health of our communities. The past 30 months are indescribable in words. Only emotions are adequate. There are times that in my role within the hospital that I am humbled by the efforts and accomplishments of all of the staff who make up UI Health. I would like to take a moment to personally thank every member of our employees and staff. I do not have time to list all of the people on our staff who have led and made this happen. And I even can't include David Laufing in that list, who was the administrator responsible for this. The past 30 months have put this organization to the test. And our healthcare team has been resilient and responsive with each turn in the road since our first COVID patient 30 months ago. So, since March of 2020, UI Health has implemented a new electronic health record, navigated the global COVID-19 pandemic, and now completed the construction of a new and wonderful clinical building. Indeed, any one of these major projects is enough to keep an organization busy and focused. I remain in awe and admiration of the achievements of our entire UI Health community over the past several years. We simply cannot state it enough. Sincerely, thank you. My last thought is about health equity. Many have described this concept as equal access to care. I believe that what we are accomplishing with and within this building and the welcome atrium that is across the street and will open later this year, I believe it is access to equal care for our constituents. Our facilities are now equal to those of our academic medical centers here in Chicago, which is what our constituents deserve. I'd like to now introduce my collaboration partner, the Executive Dean of the University of Illinois College of Medicine, Dr. Mark Rosenblatt. Thank you all. Thank you.
Well, thank you, CEO Zen. And once again, welcome and thank you to our distinguished leadership and donors and guests here today. So I usually try to start off by saying something fairly profound. Today it came to me, wow. Not so profound, but true. We are opening a specialty care building here at UI Health. It really is truly the decades of work. It's a culmination of so much work. And I can tell you that the idea was met with quite a bit of skepticism. I am the personal owner of a stack of documents spanning 20 years that describes building a new Ioneer infirmary. Didn't happen. I'm sure there's an equal stack that describes opening up a new outpatient surgery center. But we did make it happen. And what changed? What happened? I know it's been described, we've been trying to do this for a long time, but what has changed? And I really do think that it is our leadership, under the umbrella of a unified UI Health, a leadership of Dr. Barish and others. We've really seen a renaissance in the relationship between our College of Medicine and the University of Illinois Hospital, Mike Zen. And we've worked collaboratively, and this collaboration has allowed us to dream big as we plan the programs that would be housed in the specialty care building. It went from being a 2-story building with a small footprint to this amazing 6-story building that you see before you. We made a true commitment as partners in this aspirational project around the financing, around the operations of what would this building look like. I should also emphasize that our generous donors, the Pasquinelli family, the Panton family, have been our partners as well. And of course, they've been generous in their funding, but they've been even more generous in their spirit, their passion, and their shared vision of what UI Health and our college can be. So you've heard some of the numbers. As the specialty care building opens on September 26th, just around the corner, it will accommodate the growth in inpatient surgery cases and provide comprehensive outpatient care for UI Health's diverse patient communities. It'll be about 200,000 square feet, including 6 floors of patient care. We'll see about 200,000 ambulatory patients every year. We'll provide a new home for outpatient surgery procedures, 8 operating rooms, 24 pre- and post-procedure bays. It also will house world-class clinical programs in ophthalmology, otolaryngology, transplant, and urology. We're fortunate to partner with the College of Pharmacy to provide outpatient pharmacy compounding services in the new building and to make sure that patients getting surgical care can get their prescriptions before and after their surgeries. So yes, the SCB and OSC, the specialty care building, will be a place where amazing care will be delivered to some of our community's sickest patients. It is a beacon to the community. But this beacon shines within the context of an academic health center whose mission is to advance health for everyone through excellence in clinical care, research, and education, as well as social responsibility. So in addition to the healthcare services offered in the new building, it will also be the home to the educational and training experiences for our medical students, our residents, and our fellows. The next generation of spectacular and compassionate physicians will be trained in this building to meet the needs of the state of Illinois and beyond. Moreover, it is a place where groundbreaking clinical discoveries will be made that will impact how we deliver specialty and surgical care in the ambulatory setting. Indeed, UI Health will be one of the few places in the world where surgical robots are located in an ambulatory facility. And this will allow for innovation to reinvent how we can deliver complicated surgical procedures to patients and allow them to go home the same day. So this opening fulfills the long-standing dreams of so many at UI Health and our community. And I am remarkably proud to be part of UI Health and grateful to those who have worked so hard. We can truly accomplish big things at UIC. And as the Dean of the College of Medicine, I look forward to continuing our partnership at UI Health in the years to come as we continue to advance our laudable missions. So now, I'm honored to welcome State Representative Collins, who's been an ardent supporter of UIC and UI Health. Representative Collins.
Good morning. Oh, come on. This is a really exciting day. Good morning. All right. Thank you to President Colleen and Michael Zinn for bringing this vision to reality. And thank you to UI Health and to all who played a vital role in this new state-of-the-art specialty care clinic. Everyone from the brains behind this master plan to our amazing donors, to the designers, to the people who helped, the persons who helped to build it from the ground up. Thank you to our aldermen for your support. And thank you to everyone in this room. I'm extremely excited about today because this is a new addition to our healthcare community. This specialty clinic would deliver top quality service to our surrounding communities, but also create 100+ new jobs for families. This inpatient and outpatient clinic will accommodate increasing volumes and complexity of surgical care and education and research. UI Health has taken healthcare to a whole new level. Now, I represent, you can clap for that. I represent the medical district, so I might get some phone calls tonight, but this is home to me. Because as a young girl, I was diagnosed with seizures, and I got my care right here, right here. And so 23 years later, I haven't had a seizure since. And that was because of the care that I was given from the doctors, from the staff, just from the support system here, and I am so thankful for you all. My sister is a liver transplant survivor. She went to several different hospitals before she was diagnosed with autoimmune hepatitis, and it wasn't until she came here to UI Health where she was diagnosed and she was given a liver, and she is now 13 years as a survivor now. I have all three of my sons that I gave birth to here with my midwife. And I would tell you, the care that I receive as a patient is top-notch care. My doctors talk to me, they walk me through step by step of everything that I need to know, and I feel comfortable when I walk through the doors, from the people who greet me, to the people who take my appointment or my follow-up appointment, to the calls that I make, to logging into my chart. It is a totally good experience, and I have not changed my care provider, my care service from here since I was 16 years old, when I was old enough to come back and receive this service. So thank you, UI Health. I could go on and on about the incredible work being done here, but as you can see, this is another reason why, in my opinion, UI Health is leading in the healthcare realm. UIC is leading in research. And we should all be proud to be a part of this community. And because of the top quality care and the innovation it creates, an environment for patients such as myself that makes them feel like they're at home. So I'm thankful to know that we have a team of champions who consistently think of ways to deliver the best quality care and put it into action, and that they exist right here in the 9th District. Thank you all for your dedication and your service to our community of giving the best quality service, creating jobs for families. To the members here in the 9th District and the surrounding communities, it is a pleasure and honor to serve you all. Thank you.
Thank you, Representative Collins. Your story and willingness to share your experiences and continued commitment to UI Health are incredibly powerful, and we deeply appreciate your advocacy for the work that happens at UIC's academic health enterprise. Thank you, Lakeisha. So now, as we close our program on behalf of UIC and its academic health enterprise, UI Health, I want to once again extend our gratitude to all of those who helped support the launch of this building, and thanks to each of you for being with us today. I do want to thank the staff of the Vice Chancellor for Health Affairs, the staff of the hospital, and the staff of the Chancellor's office. People have been planning this opening for almost 3 or 4 months, and a lot of work has gone into this, and I really want to thank, I can't name everyone, I'd forget someone, but thank you for all that you've done to make this such a successful event. Now, just for a little bit of housekeeping and instructions, we will now proceed for a formal ribbon-cutting photo at the front of the building. We'll be guided by leadership and other key stakeholders to the corner of Wood and Taylor, where we'll take several commemorative photos. Those of you who will not be joining us for the photo, please proceed into the specialty care building using the entrance on Taylor, immediately across the hospital entrance. You may then proceed to the specialty care building welcome lobby and tour through the building using the guided tour mapped out. Now, we'll proceed immediately to my right for the ribbon cutting photo, and once again, thank you.